Today we're going to talk about NGT. I don't know what you know about NGT, but I took this topic and I created a bunch of questions where they can ask you questions. So we're going to dive into easy, straightforward questions, but critical thinking to be able to figure out about NGT. The simple equipment that you need to know, that when they ask you questions, you have to think. NG tube, there is different kind of NG tube. Okay, we talk about the SAM tube. The easy one is it look like that. It has opening here, and then there's a side tube. This is usually like blue color, right? Some of them have some feeding, but some of them also has just one. So this is like blue color. And this is the air vent, right? This is air comes here through here, and there's holes, different holes, and there's length or markings on it. So he does his job because there's different holes on it, and you can tell on X-ray what level, what is the last opening that you can find, right? Most of the time, this is connected to a suction. You have to know the function of the NG tube, the function of the venting system, then why the reason why you have the NG tube. Remember, the number one function of NG tube is for decompression. It's not used for feeding. It's a decompressive system, closed system to decompress the gastric content. People have abstraction, but it can be adapted to use for feeding. So when you see a question, you just have to know the function, the other portion of the NG tube and what you do. So this is the first question, right? As usual, you get to read the question from the back. You figure out what the examiner is asking you. Which of the following interventions should the nurse perform prior to the surgery? Patient is going to have surgery. Which of these will you do? You don't even have to read the stem of the question. The last portion of the question always give away what you need to focus on. But we know you still have to read it. A client with NG tube is scheduled for surgery. You see, underline the buzzwords. This connect the dot like a parser, right? I have NG tube. I'm going to surgery. Which intervention is a priority, right? What would you do if you're taking care of this patient? Do you want to document the tube length at the insertion site? Or do you want to give the patient administer regular oral medication before they go for the surgery? Or ensure that the NG tube is secure and taped appropriately, right? And patent. Or change the tube to a new one. What would you do? Questions, when somebody said a question, there's a reason why they said a question. One, there's a reason why they give you those answers. Two, and there's a reason why some of the answers will be related to each other. Three, and there's a reason why the right answer will be just sitting there waiting for you. But it requires you to think critically so that you don't fall for traps. If you taking care of this patient, put down your answer. Tell me, what will you do? It's a straightforward question, right? You have a patient with an NG2. He's going to have surgery. What would you do? What would you do? Tell me what you think is the right thing. You're going to check the length of the either insertion site or give the patient the prescribed oral medication or secure the tube and make sure it's patent or change the tube to a new one. Which of these you think is an appropriate action that a nurse should do? All of them may be right, but the word intervention the nurse should perform before the patient go to the surgery make the emphasis on something very important. Right. So what would you do? Right. So put down your answer and let's see what you think. Which one is the important, right? If you check the length of the insertion site, or would he provide any information that you don't know, or will you help the patient, right? Will you give the patient prescribed medication? Definitely, you know this is wrong. Patient is going to have surgery. Oral medication is contraindicated. These test taking strategy, you can tell, like critical thinking, this should not happen, right? Why would you change the tube for a new one? It's very painful to place a new NG tube. It's not easy. Sometimes you get lucky, sometimes you don't. So putting the patient through this trauma is a problem. You see, I've eliminated this, we've eliminated that. Then you left with that. You check the insertion side. This is you secure it in place and make sure it's working. This is safety. This is also safety. But if it's not secure, this doesn't work. Therefore, the right answer is number C. Just think about the answer choice and break it down easily. This will not prevent the tube from dislodging and it will help the patient dramatically. Each part of the NG tube system may be responsible for this. So that is the key. You're looking for a portion of the NG tube. NG tube are different parts. A client with NG tube is experiencing gastric reflux. If you watch my video, and you can see that I do the same thing over and over and over. My buzzword, reflux, right? And it's a part of NG tube. This is all you focus on. Which part of the NG tube, if it's not functioning, is going to cause gastric reflux. Is it the distal end? The distal end is the tip of it. Okay, so this is the distal end. The venting port, this is the venting port. The feeding port, it can be thus. The pH strip, this is off. So it has nothing to do with the NG2 part. I just try to eliminate that so that you can tell it's not good. Like NG tube does not have pH strip on it. So it's a trap, okay? Very trap. So I just eliminated it right away. Now you have three options. Is it the feeding portion here or the venting or the distal end that if it's not functioning, the patient is going to have reflux. You have to think about it carefully and imagine somebody who has an NG tube and then the patient is having reflux. Which part do you think may be responsible that is more functioning, is not acting well? Is the venting or is it the feeding portion or the distal end? What do you think? I can tell you, feeding port is where food go through, right? It's the same area that the suction is connected to suction, right? It may lead to, if it clogs, it may lead to probably reflux, right? Venting is where air go through, right? It may also be, right? But the most important thing is the distal end. Think about it. If you have a straw, you put a straw in the water and you suck in. If you suck in, you're getting something into your mouth because of the distal end, right? If the distal end is blocked, you can suck all you want, nothing is going to come out, right? Nothing, if this is blocked, you can suck here all you want, nothing is going to come out. Therefore, if the NG tube distal end is not working, there's going to be fluid in the stomach. Patient is going to reflux. This is a thinking question that you have to think carefully. So it's the distal end, if it's blocked, that will cause the individual to reflux. Okay. What is the significance of this marking? And next, note that the NG tube is marked at a certain length at the client nostril. So what does that mean? So this is the individual nose, and they have the NG tube, right, going through, and we've marked here like that. Why did he do that? Is it because It indicates the correct length of insertion, or it shows the placement for feeding administration, or it helps to confirm, this is a confirm tube placement, or it serves as a reference for tube replacement. This may be a little bit hard because of a bunch of words there, right? But think about it. When you see a marking, rewrite the question on your own. I always tell you, rewrite the question. If it's confusing, make it sound better to you. If you see a patient with an NG tube and there's a marking on the nose, what does it tell you? Does it tell you that this is the correct length of insertion? Or does it tell you that this is where the placement of feeding administration should be? Or does it confirm that the tube placement? Or does it reference, it serves as a reference for whenever you want to place a tube, that's where you're going to stay, right? A reference for tube replacement. If you want to replace it, you should stay at the same mark. Is that what it means? You should think about it. Every time you place NG tube, there's no reference. It's a gauge. Oh, it's at 45 centimeters. I will aim towards that, but it depends on what the patient is doing. You may be coughing, you may go deeper or anything like that. But that does not mean that's where you're always going to be, right? It does not confirm tube placement. There's certain things you can use to confirm placement, right? X-ray, pH, right? All those things. So these marking does not confirm, right? It does not show the placement for feeding administration either. It just shows you the correct length of insertion. This is the length we have inserted to. So that's what it means. So for this question, it's A. I know some people get it. So this is the correct length of insertion. This is another portion of the NG tube. Which part of the tube is most critical to assess for patency before beginning the procedure? So the key word is what? A nurse is preparing to change the NG tube. Which part of the tube is most critical to assess for patency before beginning the procedure? What is the key word in the question? Which one is the buzzword? If you focus on the wrong word, you're not going to get an answer. So which of this is the key word or the buzzword for the question? Okay, if you want to change the NG tube, which part of the tube is the most critical to assess for patency before beginning the procedure? I know you know NG tube, you've seen it before, you've done your clinicals, you've injected it, you've done everything. Which portion is the most critical for the patency? So what is the keyword you should focus on? Right? Patency, right? That means it's working. It's doing what it's supposed to do. Things can go in, out, back and forth. Air can go in there. So which port? I told you the NG tube. The N is the distal end. The venting tube is here. The feeding end, which is connected to the suction, right? So the proximal end is the same thing where you can suction. Sometimes we can use this is the port. The feeding port can go through the proximal end. So is where things come through before it come out, right? This is the distal end. The distal end is always in the stomach, right? And the proximal end is connected to suction where you can feed the individual and the vent. So if this is clogged, nothing will come out. So this is how you can check for patency. So you always want to check that portion. So the distal end, if you see that they can change the question, it's the same thing, but it's just wording. So the distal end is what will give you that. What should the nurse do now? You know the part of the NG tube now. So what should the nurse do first? During a routine assessment, the nurse observes that the client NG tube is covered with a dry secretion at the insertion site. NG tube is covered with what? Dry secretion at the insertion site, right? What should you do? Clean the area with antiseptic solution, change the tube immediately, assess for signs of infection, document the finding in the client chart. It's all depend on what you're going to focus on in this question. Then if you focus on it, then that will direct you to the right answer. So what do you want to do? You clean the area with antiseptic solution, or you remove the tube and place a new one, or you look for signs of infection and document the finding. Before you answer the question, ask yourself, what is they asking? They said the NG tube is covered with the dry secretion at the insertion site. So what do you want to do? It's straightforward. That's the patient knows the NG tube is going here. You see the secretion at the insertion site. What are you going to do? Just clean the thing. You don't need to change the tube immediately. That's like another torture. I mean, whatever secretion is coming is going to deposit on the tube anyway. Of course, you're going to assess for infection. But how do you assess for infection? You got to clean the thing first, right? You should not document anything. Just clean the thing. So it's just straightforward questions. Just assessing for infection is not going to help you. Documenting the finding, of course, is not good. Removing the tube is putting the patient into another. Just cleaning it will be much better for this patient, right? Now, this is the same thing. You see, I'm back again. I want you to know these kind of questions are straightforward, but you have to like understand the part of the NG tube. And this is educating a new graduate about component of the NG tube, which part of the NG tube is primarily responsible in preventing gastric distension. The next should include in the teaching. This is another question. You have to know, pick your poison. Which one is your keyword? And if you know your keyword, it will make the question easy. Which one is your buzzword? I always say the buzzword in the question will lead you to the right answer. Which of these do you think is a buzzword? And if you look at it, the answer will be like staring at you. Which one is the buzzword? Which word in the question is a buzzword? Is this one, gastric distension. If you figure it out, it said, okay, gastric distension, that means the patient belly is big, right? It's distended by as the NG tube, right? What is going to cause that? So as we talk about it, as you can see, if you know the path of the NG tube, the venting port is what air goes through here. Air goes here and goes into the stomach, right? And then when he goes here, he allows things to sump. And then when you suck him, it comes out like that from the suction. So the venting port is what is going to be responsible for distension. You can check when your patient has NG tube and you start pushing air through there, they will feel it. So the part that is responsible for gastric distension is the venting port. That's the air port. That is what is responsible. The distal end sac and keep it patent, right? But the air go through the system through the venting port. That's why they can give you a question and they will tell you the nurse capped the venting port. That's what you have to intervene. You're not supposed to put anything here. If you cover the blue side, that means something is wrong. Air cannot go through the NG tube, so the NG tube cannot function. Air need to go through the vent, come out, and then it pushes the fluid as it gets sucked out. So this is the sampling. And if you listen to it, it will make a sump. That's what we call sump tube. And some NG tube, they have different kinds. There's a Levine and the samping tube. The sump tube is the one that you can hear the whistling air coming through here. So it's the portion that is responsible for distension if is the venti aspect of it. Okay. What is the first action the nurse should take? And nurse noticed that the NG tube is not secure properly and then became dislodged while the client is repositioned. Once again, a nurse noticed that the NG tube is not secured properly and becomes dislodged while the client is repositioned. What is the first action the nurse should take? That means you reposition the patient and boom, the NG tube came out. As a nurse, what do you think? Critical thinking, prioritization. What would you do? Do you put the tube back right away? Listen to the individual along, assess for client respiratory distress, check for residues before reinsertion. When the NG tube dislodged, you're going to aspirate. That is always number one. The aspiration is a form of airway. Therefore, listening to the heart is not going to be a problem. Your heart is far away. Fluid coming out from your GI tract never gets to your circulatory system. It goes to your pulmonary system. And therefore, using that analogy, you can pick the answer right away. It's going to your lung. You're going to aspirate. Okay. Which intervention is essential to prevent diarrhea as a potential complication? Once again, read a question from the back and it will give you a perspective. Intervention, diarrhea. What will you do to prevent diarrhea? I've not even read the first portion, but I know I'm preventing diarrhea. Patient has an NG tube and is being fed continuous feeding through NG tube. How do I prevent diarrhea? Think about it and say, okay, diarrhea is related to if you eat something, you go McDonald's and you go and eat and the thing is not good, you give you diarrhea. Same thing, patient is being fed. What would you do to prevent that? Give the feeding faster and make sure the formula is at room temperature, or check the residue before feeding the patient, or use a high fiber formula. I told you sometimes the answers make sense. There's a reason why I give you that, right? If you know what the fiber does, fiber make you go, okay? Okay, it's a bulky agent. You go more often. Patient is having diarrhea. If you give them too much fiber, well, they're going to go more often, right? It's not a good idea. If you feed them faster, they get dumping, right? It's the same thing as dumping syndrome. You see how whatever you learn, it come into place. You dumping the fluid into them, it's going to come out the wrong way. You give him too much fiber, it's going to come out the wrong way. Now you're left with do you want to feed somebody at room temperature? If it's not appropriate to give them a feeding formula at room temperature, then you know what the right answer is. You see how the answer choice is right there in front of you, right? So you can see the right answer is you got to check residue. Why? Why do you want to do that? Why do you want to check residue volume before each feeding? That your strategy to prevent diarrhea. Why do you want to do that? Remember, if you're getting continuous feeding, like every hour, if it's set to be like 40 ml an hour, which is small. Usually they get like 100 ml, 200 ml. So every hour we dumping 400 ml. And if like 4 hours, they have this times for 1600 of feeding in the stomach. If you check residue and you know that you're getting what 400, that means they did not empty everything out. This is why they're going to be dumping that into their GI tract and have diarrhea. So checking for residue and making sure they're tolerating the feed is the most important way to do that. So every answer choice makes sense. So next is monitoring a client with NGT for complication. Once again, simple, straightforward, NGT complication. Look at these signs, right? Which of these tell you the patient is having complication? Client report mild nasal discomfort. He said his nose is hurting. A client has a bowel movement within 24 hours. He had bowel movement within 24 hours. Does he indicate complication of the NGT? The presence of distension and decreased bowel sound, where his belly is distended and then decreased bowel sound. His respiratory rate is 13 at rest. Does this indicate complication of NG tube? Most questions you see on NCLEX is all content-based and knowledge, and sometimes you apply test-taking strategy, but be able to identify, you got to pick your poison. NG tube complication. Well, which of this? What does the NG tube do? It's used for suctioning and feeding. It look like these answers look like they are for feeding. Some are for feeding, some are for what? Suctioning. We can tell. But which of this indicate that I'm having problem with the NG tube, right? Respiratory rate of 13 is okay. Your nose, you have these big 18 friends and in your nose, is going to cause problem. You're going to have discomfort, right? If you move in your bowel 24 hours, hey, things are working. This guy is distended and then no bowel, decreased bowel sound is getting ileus or obstruction. Yeah, we got to figure out what is going on. So that sounds like a right answer for us. What should the nurse do? Next, a client with NG tube is receiving enteric feeding. The nurse noticed that the feeding formula is separating and has a layer of liquid on top. Read it carefully. The nurse noticed that the feeding formula is separating and has a layer of liquid on top. So it's separating. So if you look at the formula, you to look at it in the tube, okay, there's a layer that is separate and then there's another layer here. You can see a line between there. Do you throw it away, discard the formula and use a new one? Do you shake the feeding bag to mix the formula? Do you report this to the healthcare provider? Or do you change the feeding bag immediately? What do you think? I know you fed a patient before with the NG tube. And when you take the feeding bottle, you see that it's separate. The top, it look like liquid clear. The bottom look like condensed stuff like the feeding formula itself there. What do you do? Do you discard it or get a new one? Do you change the whole feeding system? Or you call the doctor and tell them, or you shake the thing and mix it? You got to be familiar with formula usually most formulas will condensed into their content, and what will be left is a liquid on top of it. This is normal. Unless they tell you it's expired, you do not discard the thing. Okay, there's no need to discard it if it's not expired. You don't throw it away so far as it's within the expiration date. If you shake it, it will look like something new. So mix the thing. The doctor will say, well, deal with it. I don't care about it. You don't need to change the feeding system completely. It has nothing to do. D is a trap. It does not answer the question. The question, look at it. I want you to guys to, these are the things, when I create questions, I use it just to teach you. I don't want you to memorize it. The question never asks about a bag. Why will you pick D? The question never said anything about a bag. I said the nurse noticed that the feeding formula is separating and it has a layer of liquid on top. Why would you change the feeding bag immediately? It has nothing to do with the feeding bag. We're talking about the formula itself. Okay. You can see the right answer as a formula in it. The trappy one also has a formula in it. Look at it. Discard the formula and use the new one, right? That's the key. This is just saying you should change the bag, but then what was separating was the formula. Therefore, the right answer is just mix it, and you'll be fine.